but I still got ties with it. We got that car show we have in August. I'm still with that. And then I have with the ham radio stuff, I got repeaters up on the water tower there in Shiloh, which I got to take down by the end of August because they're tearing that water tower down.
Good morning. It's 9:30 a.m. on Tuesday, June 20th. The Richland County Board of Commissioners is now in session. I'm Richland County Commissioner Cliff Mears, joined by fellow Commissioner Tony Barrow, Darrell Banks, our clerk Stacy Kroll, County Administrator Andrew Keller. Mr. Morgenstern is here, and we're joined with three members of our radio group. And that is the first order of business that we have today. And we have online, we have Alan Carl from the media. If you gentlemen would like to introduce yourselves for the record, would appreciate that.
Okay, I'm Danny Bailey. I'm the Inner City Image Radio Club, our local club president. And I'm also the district emergency coordinators for wind disasters. I'm over 6 counties. When something happens, I get ham radio operators to come in and help us. So
I'm Dwayne Meadows, K8MDA. I'm the vice president of the radio club and the emergency coordinator for don't get this, Morrow County.
Okay. And
I'm Scott Yonley. I am the Vice Director for the Great Lakes Division representing Ohio, Michigan, and Kentucky. I am also the Vice Chair of LAPC here in Richland County.
It's like Star Wars. Every time Scott comes in, his rank gets higher now.
well, we're here to talk about what you guys do and recognize Amateur Radio Week. So would you like to take a few minutes and tell us what you do and how you do it and why it's important?
okay, what we do with our group, we have Amateur Radio Emergency Service, and then of course you guys, we do a lot of the weather stuff, Skywarn program, and we're the ones that kind of watch the weather a lot for Richland County, and then we have spotters whenever you hear some severe thunderstorm warning go out. Our guys go out and look and watch in case we see a funnel cloud or anything. And Cleveland loves that because they can't see a lot down here on the radar, so we help pick that up, that end of it. And then on the other side of it, we help the EMA if they ever need radio communications on. They send a CERT team out or something like that and need radio communications for different things, even back up the communications for law enforcement, whatever they really need us to do radio wise. We can back them all up and do that with ham operators. We can go in because we have our own equipment, nothing, we provide our own equipment. And it's just a little thing we would like to do. And like recently, we just, of course, with the LAPC exercise. Okay, now they kind of have an idea what we can do back up if they set up a shelter or something. We can provide communications for that. Also, too, last Sunday we are the ones that line up the Miss Ohio parade. We do the big Miss Ohio parade every year. We line it up out here for the Renaissance and for the people that's in charge of the Miss Ohio parade. So we do that every year for them. And then this weekend is what we call as our field day. What it is, we go out and set up. We'll be setting up at South Park here in Mansfield. And what we do is go in and set up ham radio stations in there and try to see how many. Okay, it's more just like an emergency communication drill. That's what it is. If we ever have a big disaster, let's say here, you need to get a message somewhere, phone lines are out somewhere, we can relay, have an operator maybe be out there in another state, can talk to them and tell them what's going on, relay messages, health and welfare messages. We can do that. Just more or less, we do all kinds of stuff now. Digitally, thanks to good old internet, we now have it's called Ohio Link Network. With one key up, I can sit here, key up a radio, and I can talk to the Ohio River and Lake Erie at the same time. So anybody between there, if we have anybody between that link needs any information, we can set it up. It's all done, of course, by the internet, and it's fantastic situation for them. There's different digital modes now that's out that we can play with.
Wait a minute. I thought the whole point of ham radio was that you didn't need the internet in case of emergency. Now you're telling me we need the internet here?
No, I tell you need it. Okay, we can use the radios, do it. Yeah, I know. Yeah, I
I'm
knew
like,
you,
wait a minute,
I know
that.
you're gonna get me on it.
Ham radio?
I know you're gonna get me on it. But it's but yeah, no, like I said, it's a tool in our toolbox. And it's a tool in there, but yeah, like I said, yeah, we can, communicate across the whole state. We really don't need the internet, but it makes it so much easier. But the radio communication side of it, we mostly use our radios for that's what we bought them for. And before the internet, that's the way it was. And we had set up different relay stations. We could relay different messages between one another. And it's a pretty good hobby. If you guys ever interested, now it's so much easier. You don't have to know that good old Morse code you used to have to know. You don't have to do that anymore. You just get on there, take a test, and pass a test, and you're a ham radio operator. So that's all they are to it. No more Morse code unless you want to, mess with it.
I had a neighbor who claimed to be a ham radio operator, and he said it was an antenna strung across his yard through the trees.
Mhm.
That's that common?
Mhm.
Yes.
That's normal. That's okay. Yeah.
That's the only thing about my neighborhood.
If you want, okay, this
He's
weekend,
since moved on, so I can say that.
He's not a voter, is he?
This weekend, we're talking about that field day we're gonna be at South Park. Come out there, we'll show you antennas in the trees that we're gonna be talking. Like I said, it's just a piece of wire. That's all it really is. That's really most of a piece of wire, and
Okay.
we just talk to it. And like I said, anybody that's listening is interested, come on out. It starts at 2 p.m. Saturday and ends at 2 p.m. Sunday. So we'll be out there all weekend. And just come on out. You watch us communicate. We do the digital communications. We do CW, the old Morse code, and then we do the voice side of it. So you get to see all different modes of it we get to use. And if we catch it right, we also can use satellite. There's amateur radio satellites. We have an antenna you hold in a little mic, and you can talk through the satellites floating around. You catch them going by. So like I said, it's all kinds of different things we can play with.
And they also download pictures periodically from the International Space Station, and we can just hook our radio up to the computer and copy those pictures. It's really cool. I really enjoy doing that. But the wire antennas work very, very well. That's mostly what I use, and I've got 155 countries confirmed in every state. So it doesn't look like much, but it works really well.
I've been out to your day, and I know Tony has too.
Yeah.
And it's interesting, and it's surprises you what all you can do.
Right. Right. Yeah, you guys are welcome. Come on out. And of course, I know you like to eat.
What time?
Everybody likes to eat.
Saturday, and it's at South Park
Okay. It starts at 6. Starts at 2 p.m. Saturday.
on Saturday
2 p.m. Sunday, 24 hours
at South Park.
at South Park.
Okay.
We'll be in the blockhouse, the cabin, and probably the blacksmith shop. We'll be set up in those places. They give us something set up this weekend. Yep.
What we're calling that, what's the exact title? Let me see if I can swing by and get in my calendar. We also have Source Fest that day too, so I'm trying to squeeze everything in.
Yeah, okay, yeah, it'll be, what we call, like I said, it's, a field day is what we call it. Every year.
I didn't see it on a T-shirt or something.
Yeah, the t-shirt.
Right.
Yeah. And on the back of them, it's got all the states. If you want to really get, I can walk up behind Dwayne. Oh, we got this state, Dwayne. I can tap the little square and I can color that in for you. That's the way they make them. So you see how many most of it's got the, United States, states and the territories. It's all, that's what's all on the back of these. That's what you try to reach this weekend is them. And that's all by that little piece of wire is all you use. That little, and no internet, all a little piece of wire.
Interesting stuff. Any other comments, questions? Well, I do have a proclamation proclaiming June 18th through June 24th as Radio Amateur Week. I'd be glad to present that to you, but I've got to say, when I read through this, I didn't realize where the word ham came from. And that was when the first amateur wireless radio station was operated in 1908. It was by three men by the name of Hyman, Almy, and Murray, Ham. And that's where it came from. So how interesting is that? So gentlemen, I'd like to present this to you now.
I'll do this.
I hope to be there this weekend.
Well, come right on over and see you. We're glad to see you. Like I said, we want to invite you guys, Saturday night, 6 o'clock. Come on out. You can have your shredded chicken sandwich and sloppy Joe or a coney or whatever you want. Come on out.
Talk to my language.
There you go. Come right on out. You guys, we're glad to see you guys.
See you there.
Okay.
Al, do you have any questions for our gentleman here?
No, I don't think so. I think they cover it pretty well. Just want to say hi to Scott because we sat on Ashland County's LEPC for years.
That's right.
Okay, thanks, Al. Carl, any questions?
Just curious, was there any activity by your organization? I'm just trying to think back last summer when we had the tornado kind of come out of nowhere and power was out locally for a number of days. Anything you guys might have done at that time?
Okay, all right. You talking about the Shelby tornado?
No, I'm talking about the one that went down through past Belleville and into Butler and down in that area last year.
Oh, okay, yeah. All we got was from that, yeah, we just had a few hands radio in that they had trees down and electric lines down, from the trees falling. And that right there, but when we get, yeah, we was active then, but we had hams down there and all that, that was the only reports they really give us until later on. Some of them said it might have been we're talking not the National Weather Service, but residents saying that, it possibly could have been they felt like it was a tornado to them and all that stuff. But what they do is, just on that side of it real quick is we get reports by the radios. And then I contact me or whoever's running net control, which controls everything. We run a net and we get a hold of the National Weather Service and let them know what we have down here. And we just keep sending reports to them and they like for us to do that because that makes their weather reports that they have to turn in every year for different situations, makes them more real to them because they got, stuff in the background to go with it that we reported this happened, that happened.
Okay. And if Tony doesn't get Lucas hooked up to the internet pretty soon with the tower, can you guys set up like a permanent operations base down there?
Very funny. I have an announcement about that towards the end of the meeting.
I'm just teasing. Thanks, guys.
Thank you.
He could give us space on that tower to put one of our repeaters up. Yeah, he could be nice and do that. That'd be great down at Lucas.
Yeah, we could do that.
Yeah, we can do that.
Alternative to wires in the trees. Right?
Yeah. I said it'd just be a repeater we'd use out of Lucas.
I think that's a great idea, Mr. Vero. I think you need to make that happen.
On it.
Thank you, gentlemen. Thank you very much. And
All right, thank you very much.
Okay.
Thank you. Yeah, guys, come on out this weekend and join us. Have fun with us.
I won't eat for 3 days until I get there.
Yeah. Okay. And how'd your trip to England go? Last time I talked to you, you was going, that's where you was going.
It was fantastic.
There you go.
Better.
Very good.
Thanks for asking.
All right, guys.
Okay.
Thank you.
Hey, gentlemen.
Hey, radio guys, we're going to try to swing out there. Me and Mel and the kid will swing out before Source Fest.
You gonna bring Brett with you again this year?
I don't know. We probably won't come with me because I'm going to go to Source Fest. It means I'll have to see Carl probably, but
Right.
I'm going to get out there.
I think Marilyn's coming too. You talked to me, she's
That's
on.
why I'm going. I got to upgrade it. I mean, she's a downgrade. So
Yep.
Well, we'll be glad to see.
You'll be glad to see you guys. You guys come on out. But like I said, start at 2:00.
yeah, we'll
Remember, it's from 2:00
I
Saturday.
try to swing out there before Source Fest at some point.
Like, 2:00 Saturday till 2:00 Sunday. So if you want to come at 2:00 in the morning, come on, we'll be sitting there. All right, thanks.
All right, guys.
Thanks.
Thank you.
Good to see you. Thank you. Okay, well, we got a couple of quick things before we call on Wendy from Sebco. So the first order of business is to certify the record of proceedings for June 15th.
So move.
Second.
Commissioner Mears,
Yes,
Commissioner Banks,
Yes.
Mr. Farrell.
Yes.
I have a motion to approve requisitions.
So move.
Second.
Commissioner Mears,
Yes.
Mr. Banks,
Yes.
Mr. Farrell.
Yes.
And we have a request from Joda Cachetti to amend the minutes from June 13th to state that the application for the enterprise zone that the commissioners approve the application rather than accepted the application.
So moved.
Second.
Banks?
Yep.
Mr. Pharaoh.
Yes.
Vera, did you want to make your announcement now or after?
Wendy, what do you think? Can I have 30 seconds? So yesterday, on our holiday, Captain Jim Sweat, working hard, sent a note. I got an update on the Lucas Tower. We are very close to the Verizon Tower being operational. I just approved the wireless traffic plan for the 911 routing. Now, I have no idea what that means, obviously, because I'm not smart. So I asked for what that meant. And he said it usually only takes a couple weeks once the wireless traffic plan is approved to go live. So I know we had slated for October of 2024 to have cell equipment in Lucas. I'm trying to get a definitive date. Carl's come up with some creative ideas for a kickoff or something, or make a cell phone call. So I reached out to Verizon this morning to see when we might have a date, and also to, hey, say thank you because you guys finished it ahead of schedule, hopefully. So we believe in a month we'll have cell coverage in the village of Lucas. So that's an update, and I'll see if we can get a definitive date.
Long time coming. Great.
That's right. So we can cross that off, right, Wendy?
Sounds good. Good people in that area are thrilled.
Very thrilled, very thrilled. So
Good move.
that's our update, Carl.
As long as it's there by football season, so I don't have to stand at the 32.5 yard line to tweet out results.
That's funny. Jake Furr comes prepared and he's got all the boosters necessary. He don't have any problem.
Jake Furr is 6'7". I'm 5'7". He's a foot taller.
Well, Carl, do you have any questions on anything else?
No, I don't. Thank you.
Okay, Al, questions on anything in particular?
No, I don't either. Thank you.
Okay. Wendy, your show.
Oh, there.
And you see,
Good news.
yeah, Wendy, we want some good news today.
Oh my.
Huh?
I feel like I'm not bringing good news to any of my clients, so it is what it is, I guess. That's why we have insurance. Isn't it?
It is.
Okay, we're looking at the first quarter reports, and of course, we are very late with these, and we apologize. There was a little problem with some of the reporting mechanism on Anthem. And of course, our consultant, Ann, compiles a lot of the information, a lot of what I bring you from Anthem, but final pages that I bring you with all of the summary of numbers, our consultant does. If they are not able to pull that from Anthem, they can't put those summaries together. And we feel that's kind of loss ratios and seeing the totals on the premiums and what's paid in claims. So that's kind of real
This
important.
is a one-time blip that caused a delay, so.
One-time-
Which is almost,
Yes.
it's at the end of the
Yeah,
second.
one-time blip, and it had to do with some programming behind the scenes, not working the way that they had done for an enhancement for 2023. You know how sometimes those don't work quite the way you
Mhm.
hope they would, and you don't discover it until you go to pull the data and realize,
Is that
it's
right?
not there. So looking at the reports, your running 12-month loss ratio is 104.4 for medical, 119.6 for prescription. You put it together, it's 110.2, and your dental is 88.6. And if we're looking at just the 3-month period of time, which would be the beginning of January through the end of March, the loss ratio for medical is 113.7, RX is 140.2, combined 119.8, and then the dental is 106.3. Don't worry a whole lot. Higher loss ratios for the first 3 months, because we are aware that some services people do at certain times of the year. And so then when you extrapolate that out over a longer period of time, dental is a good example. Maybe you have set up that you go to your dentist every February and you're having some major services done. And then we extrapolate that over a full 12-month and it's not such a high loss ratio.
Okay, and so to simplify these percentages, the lower number, the better, basically, right? The higher number, we're losing money, over 100%.
Well, we're losing money.
Yeah.
Yeah. Anytime you see over 100, basically it means for every dollar we're paying out, we're paying more out in claims.
Right, right.
So for that 104, for every dollar you're paying out, we're paying $1.04 in claims. So we never like to be in that situation. What I will say though is Subco overall is also experiencing a higher loss ratio. So it isn't just that Richland County is experiencing it. Overall, everybody is. We still are looking at this as somewhat of a bounce back from the pandemic, that we are still looking at maybe some delay of services during that period of time are now taking place. And we're going to sort of realize that. We hope that we're kind of at the tail end of that, of those services that you'll remember during that time, all non-emergency outpatient services were put on hold. All non-emergency inpatient hospitalizations were put on hold. And people didn't immediately schedule it when that was lifted. So we're feeling that we're at the tail end of it now. The other thing that is really very difficult for us to wrap our arms around is the cost of prescriptions. They're just outrageous. And we're doing the best we can to come up with programs. But it's not that people don't need the medication. They do. What we have to realize is we're seeing a cost shift, that what we're spending on prescriptions, we previously might have been spending on hospitalizations, that some of these medications are truly keeping people out of the hospital and truly allowing them to work and allowing them to control a situation that maybe they could not control before these medications came about. So trying to wrap our arms around that. Okay, we're going to look at your average enrollment. And this is for the full 12-month period of time, the rolling time from August 2022 through the end of March 2023. Your average employee enrollment for employee-only coverage was 242 employees. Average employee enrollment for employee plus spouse was 90, making 180 members. Average employee enrollment in employee plus child or children is 141 for 398 members. The average employee enrollment under family was 97 for 392 members. So 570 employees and 1,212 members.
Is that up or down from previous quarter?
It's a little down from maybe a year ago, the same time frame. Not by a lot. We're talking about 3 or 4, people, employees. So, but there has been changing in tiers. So maybe where it was previously employee spouse, it's now maybe moved into the family. So it could be maybe a husband and wife and they've had a child. So we see some movement amongst tierage, but not a huge amount among the total number of employees. Your average female employee age is 48 years. Your average male employee age is 44 years, 4 months. 52.6% of your membership is female and 47.4% of your membership is male. And then if you look at the little tiers below, the graphs that we're showing, the lighter blue is female, the darker blue is male, and that's just showing you the age category of your overall membership. You can see the largest age band for enrollment is males between the age of 15 and 24, and the next largest is females between the ages of 55 and 64. And we look at this because it's a good gauge of where claims are going to fall. That traditionally don't have a huge amount of claims for people at age of 20. Where we see the large number of claims are people over the age of 30 and they're out. Dollar wise, there are not a lot of claim dollars spent on children. unless you have a sick child, but traditionally it's just well visits only. If we go to the next page and we're looking at the tier relationship based on percentage of enrollment and paid claims, 47% of your enrollment is employee and they make up 47.7% of your claims. 15.5% of your enrollment is spouses, and they make up 38% of your claims. And 37.5% of your enrollment is children, and they make up 14.3% of your claims. That's pretty typical. Children, even though they might be a third of your enrollment, they are usually nowhere near that in the percentage of claims. Spouses usually do make a large percentage of the claims. And you, of course, have your program that the spouse cannot be in the program if they have insurance elsewhere. And that probably has been a protection for you as far as finances. Because as you can see, 10% of your enrollment is spouses, but they're making up 38% of the claims. When we're looking at medical and pharmacy paid amounts summary, and we're going to look at the per member per month. And the nice thing here is you can see current and you can see prior, and then you can see the trend in that graph or that embedded graph that we've put in there. The per member per month spend on medical is $508.24, and that is a 17.5% increase over a year ago. The per member per month spend on prescription is $169.52, and that is a 1.9% increase over the same time period a year ago. Per member per month medical RX spend together is $677.76. And that is a 13.2% increase over the same time period a year ago. And then when we extrapolate it out on the per employee, breaking it down to that smaller number rather than the, the medical spend is $1,080.40. And that is an increase of 13.2% over a year ago. The per employee spend on prescription is $360.35. And that's a reduction of 1.8% over a year ago. And the per employee per month medical spend together is $1,440.75. And that's an increase of 9% over a year ago. Any questions on that? Looking at high cost claimants, and of course, we have this report set at 50,000. And what I do need to say to you is you don't have to have a huge claim to have a $50,000 claim. You can have an outpatient surgery and have $50,000. You can have an emergency room visit where a lot is going on and have it be $50,000. So it's not a big, it doesn't have to be a traumatic situation to have a $50,000 claim, which, that's very different than 10 years ago. So looking at that, you had 42 high cost claimants for the time period April 30th, 2022 through March 31st, 2023. They make up 2.4% of the spend for this time period, and they make up 3.5% of your enrollment. Total amount paid for all claims for this time period was 9.8, and high cost claim medical is 3.8. High cost claimant pharmacy is 1.2 million. If we look at the next page, we're looking at the graph that compares your inpatient, outpatient, professional, and pharmacy spend, and it compares it for a 3-year period of time, and it's the same 3-year period of time. We're looking at April 30th, 2022 through March 30th, 2023, and then the same time period from a year ago, and then the same time period from 2 years ago. So 123.31 of your per member per month spend is for inpatient, 246.57 is for outpatient, and 138.36 is professional. And they don't extrapolate out on pharmacy. We'll look at that on another page, but you can see that consistently it's a little bit larger spend each year. Your 2023, the current time period that we're looking at for inpatient is quite a little bit higher than it was a year ago, but fairly close to what it was 2 years ago. Your outpatient is way more than it was over the last 2 years. Your professional has been running pretty close to the same amount for the last 3 years. And your pharmacy is a little bit more than a year ago, but considerably more than 2 years ago. of your membership, 56% of your membership have claims less than $1,000 for this time frame. So it's kind of always interesting to see that. That's a little bit less than it was a year ago at this time. And then if we go to the next page and we look at pharmacy, top 10 medications by dollar spend are all specialty meds. And if you look at the names, you probably are familiar with a lot of the names because you see them advertised all the time. For this time period of April 30th, 2022 through March 31st, 2023, these top 10 medications make up 48.2% of your spend. This is for 321 medications of your total 14,878. The average spend for these specialty meds is $3,700 for a 30-day spend. The average cost for the other 14,557 medications is $88 for a 30-day spend. So that kind of puts it into perspective that the majority of your medications that are being filled are not high dollar, but these 10 specialty really are driving the cost. And some of them are, of course, extremely expensive. And some of them as much as, $11,000 for a single 30-day spend.
And what is that one? Revlimid.
Revlimid. And that can be used for several things. It typically is for cancer treatment, but they also have found it's very beneficial for people with Crohn's and treating. So it may be used for cross purpose just because it's worked very well for people that have immunosuppressant types of things, but usually it's for cancer treatment. Then if we're looking at your kind of prescriptions in a nutshell, the majority of your medications are generic medications that are purchased at retail. It's 12,105 of the total 14,878 are generics being purchased at retail. So basically what that means is if there's a generic available, your employees are taking the generic if it's available. When we're looking at your facility utilization, your top dollar spend in inpatient facility was at Arthur James at OSU. Your most utilized inpatient facility is Ohio Health. Your most utilized outpatient and top dollar spend is Ohio Health Mansfield. And then the discount savings. Your network utilization is listed at 96%. And I felt like I needed to do a little research on that because that's pretty low for Richland County. You're usually close to 100%. And what that has to do with, it comes through as non-network if you're paying a secondary. So you had several situations where they really were network providers, but you're not the primary carrier. Spouse who has other coverage or a child who has other coverage.
Doesn't mean a referral, right?
No. Meaning there's another carrier that's paying primary, maybe Aetna or maybe UHC is paying as primary. So then you don't get advantage of the Anthem discount necessarily. You're coming in as secondary and you're picking up whatever the percentage might be. Not very often does that happen, but sometimes. And so in this situation, you had a situation where you had a couple dependents, another carrier was primary and Richland County is secondary. And so it comes in, you had almost no liability on the claim, but it's still in, as far as the reporting, it reports it as a non-network claim. So just even though the facility was network, but you're not getting you were working on the other carrier's discount arrangement. So looking at the inpatient discount savings, it's 38.3%. That's a little lower than it's 35.8%. I did a typo there. Your outpatient discount is 58.7% and your professional is 44.8%. Total discount savings is 44.8. I see what I did. I've left off left off the image for the inpatient. One of the reasons that your inpatient discount savings is as low as it is if we look back on there. You did have some services at Children's Hospital, Nationwide Children's, and our discount arrangement with them is only 5%. So, and that's true of all the children's hospitals. Anthem has made an agreement with all the children's hospitals in the state of Ohio, just a 5% discount. They don't try to, negotiate with them to go way lower because there are unique things going on there. So don't get a huge discount bang for them. Then if you look at the two attached next couple pages that are your dollar amounts, we're looking at paid claims in that first group, and then we're looking at what was billed premium. And the only reason I want to call your attention is you may want to pay attention here because we're going to, at the end of this month, we have a board meeting. It'll be our pre-renewal. The time frame that the renewal is based on is July 2023 through the end of June 2023. So you can get a kind of feeling where you may be falling. If it looks like we're paying more in claims than you're paying in premium, then that's not necessarily a good place to be. So I wanted to be sure that
Just told us stop loss, not to worry about that.
on claims, that is true. And I'm going to get into that in a minute. But you want to pay attention to that.
All right.
Then if you look at the next page, it does show you your loss ratios and your average enrollment. And then the fourth page shows you your payments. These are from April 2022 through March 30th, 2023. So you can see you have some claims that are a significant number that are over 125,000. So anything over that 125,000, the pool absorbs. So this will bring down your loss ratio. But so we get a little better handle on where things are. I won't know a whole lot more for another couple of weeks. Any questions on what you've seen so far?
It would appear that that'd be a simple way of looking at it, but it appears our staff, our employees are in better health than our spouses.
Yep. And what I would say that
I'm gonna tell
probably,
my wife that.
well, I'll tell you why you probably see that. The way your situation is set up is that if a spouse has the opportunity to have insurance elsewhere, they must take it. Well, a lot of maybe that spouse doesn't have the opportunity to have insurance elsewhere because maybe they have a chronic condition and cannot work. So therefore they're on your policy. So you're not getting there's a lot of thought behind that. You're not getting healthy spouses on your plan who may be working elsewhere.
I only bring it up because
Yeah.
I'm trained it very well and
Okay,
thanks.
there is something else I want to talk to you about. That is a new program. We are introducing to members effective July. Actually show you.
Okay.
I'll make
Always weary when you say new program.
no cost to the member to enroll in this. And what this is a virtual physical therapy program. This is not for somebody who's had a hip replacement that your doctor's saying you need to go to physical therapy, or, if you've had major surgery that they want you for somebody that maybe has had some chronic conditions and the doctor has suggested physical therapy, you might benefit from physical therapy.
Like what?
Well, I'm going to use myself as an example because I'm currently enrolled in the program as a pilot. I have curvature of the spine. I'm born with it. I always have chronic lower back pain because my spine is curved there. I know that when I'm working out and strengthening my core, I have less pain. I also know that when I'm watching my weight and my diet, I have less pain, but I always have some pain. And it has been recommended that if I went to a physical therapist and learned how to do some exercises, it would help me. But physical therapy costs money. I mean, either you're going outpatient facility and you need to meet your deductible or co-insurance, or it's a per visit. And I've always been, well, you know, I'll be okay. We are offering this program at zero cost, zero out-of-pocket cost to the members. And I will say I'm now in my third week and it is pretty slick. What you get, you have to answer some questions. Some of the questions they'll ask is, have you recently had surgery? And if you answer yes, I had hip replacement, they're going to automatically say, no, this is not for that. They're going to ask some general health questions, but and maybe what you think you benefit from it. One of the reasons that we thought it was important to offer this is when we look at the top 5 reasons within all 46 counties in the program, top diagnoses, it's always musculoskeletal, is always in the top 5. If it's not 1, it's 2, it's 3, it's 4, it's 5. And
Back pain.
well, it can be back pain, knee pain, hip pain, anything muscular, skeletal. So, so we decided this might be a really great program to offer. It's called the SWORD program, and it actually is offered through that same entity, Live Health Online, that you do the virtual doctor visit. If you enroll and answer the questions, they're going to send you this little kit. And in this kit is an iPad, a little stand that you put your iPad on, and little electrodes that you hook up into here to make sure that they are live and that they're working. And then bands. And you put these 5 parts of your body. They go around here, around your thighs, and around your ankle, or around your calves. And you load in the little sensor into the band. You calculate it up and you sign on your iPad, and it makes sure they're working the way they are. They tell you, okay, it tells you the position you need to be in. And based on how you answered your questions, they're going to set up exercises. You're going to have a physical therapist that you're going to be working with who's going to reach out to you, and you're going to be either talking to them FaceTime on your phone or your laptop, your tablet, so that they can. And they will be texting you periodically. You'll meet with them at least twice every 2 weeks to talk to them, but they're going to be sending you texts. And they'll have designed exercises based on what you need. Immediately when you do your exercises, and usually it takes between 7 and 10 minutes to go through the regimen of exercises. And they may extend them as you get further in the program, but usually it's no more than a 15-minute commitment to do your exercises each day. And they'll talk with you. Can you commit to every day? Can you commit to 3 times a week? How many times? It's totally up to you when you choose to do this. This is on you. You may want to do it first thing in the morning. You may want to do it in the afternoon. You may want to do it in the evening. When you set up your time to talk with your physical therapist, though, you have to set a specific time that you'll work to be able to see them face to face. And they will do evening appointments. They'll do early morning appointments, whatever works for you. Your physical therapist will also, as I said, will text you. And maybe if they notice that mine will let me know, I noticed you seem to have a problem with the one exercise this morning. And it gives you your percentage as you're doing the exercise. It indicates that you got a 78% on it or a 98% or whatever. I noticed you had a problem. I'm going to pull that one out of the regimen the next time, and I'm going to replace it with something that maybe will build you up a little bit better in another area. I am amazed, absolutely amazed. I've done my 9th session, and I have nowhere near the back pain that I had 3 weeks ago. I don't feel that I'm much more physically fit, but what she's having me do is definitely strengthening my core and relieving that back pain. So I'm like a huge proponent. And I think the big thing is we question, how can we offer this at zero out of pocket for the members? You know, even on high deductible health plan, how can you do it?
That this program will offset some pharmaceutical costs? less reliance on.
Physical therapy.
Pharmaceutical and medical.
You got therapy costs, but is that?
Well, and medical, we're hoping pharmaceutical because people could be on pain medications. And if we can relieve,
Now, hold on, I'm looking at our top pharmacy here. Hold on, let me see where that comes in at. I see Humira at the top, so,
rheumatoid arthritis. Absolutely.
yeah.
So how this can be offered at zero is it has been approved to be considered a preventive care wellness program under the ACA. So we can offer this with zero out-of-pocket expense to all members. So we're hoping, we're rolling it out July 1st. There is a webinar that we've invited Rachel and Kelly to participate in this week to see the promo on it. We didn't invite all employees because this is really so that the contacts can ask questions because we know they're going to get questions once the communication goes out to employees. But we are hoping we have a really good enrollment in this. If for no other reason, if you make people feel better. And I have to say, I don't want to say I was skeptical, but when we're rolling it, I'm like, really? Do you really think that virtual physical therapy is going to do what going to, do you really think? I have to say, if I'm any example, I do not have anywhere near the back pain. The other thing is I have so much more flexibility now than I did 3 weeks ago based on some of the exercises that she's having me do. So
But it does require some discipline. To actually do it.
it does require discipline.
Daryl will put it up on the screen here and do his physical therapy.
They look at what your individual capabilities are and they tailor the exercise to,
His band's out, Banks.
well, you do look a little, as you're
I know,
wired.
that's why I can't wait to see this.
Wired up,
We'll
and it's,
YouTube live the meetings. We'll put Daryl's therapy session on for the county channel.
well, I took pictures to send to my daughters. I said, well, here I am wired up to start. And they're like, well, you look kind of a little bit alienish there. with
Oh, baby.
the hands on.
These are plugins. These are not wireless sensors. You're actually wired to.
Well, they're wireless. Once they're, I'll show you. You have to make sure they're charged, but when you put these bands on yourself, you're not plugged into anything.
Oh, okay. I saw that, all that cable
The cable, this is
charging.
while you charge it
Oh,
up.
I can't wait to see this.
See anybody sleep apnea when you do that?
Oh, yeah, I've seen it.
I think
Like,
that.
Bands are very easy. You put them, you put them around yourself.
They got bigger belts.
It totally adjusts. It's,
Oh,
you're-
Here, Daryl, get up for a demonstration.
I'd give that a challenge.
Carl, you want Daryl to demonstrate?
Please no,
Carl.
please no,
Thank you, Carl.
nor me.
put that little sensor in like that. And you're doing it, once it's calibrating and you have this on, the little blue turns to green. And before you start, they say calibrating. Okay, sensors are good. They can't really see you. All they do is the sensors know whether you're positioned in the right position to do the exercise. And I will get that sometimes. Somebody's a little, comment coming, Wendy, you're leaning too much to the right when you're doing this exercise. You need to be straight. So
So this is going to be rolled out
July 1st.
like 2 weeks.
Yep.
Oh,
We wanted to get it out this year, but we certainly want to get feedback when we're doing open enrollment meetings in the fall. And hopefully we'll have enough people in each county that have done it that they'll be able to speak to it, because we really will be pushing during open enrollment to make people aware of the program.
Wendy, it sounds like because it's preventative wellness, any member is eligible.
18 and over, any member who's 18 over, it's adults only. Yeah, absolutely. So we're really excited about it. And I will say, we're always looking at, when we're looking at where our dollar spends are, we're always looking at what are programs that can help us with those dollar spends. What can we do in this area? One of the reasons that we rolled out, our employee assistance program to all of the member counties is we started seeing lots of mental health situations. And so we wanted to, since there's no cost to use the employee assistance program, we're always looking on the prescription drug. I don't know that some of the programs that we rolled out are popular with our members, but they are saving money. I mean, members aren't thrilled that they have to fill their maintenance meds for 90 days rather than 30, but it saves us 2 dispensing fees on the back end, and that's no small savings. Things that you can do that are not really impacting the benefit, not taking a benefit away, but that we're trying to manage the money a little bit better by implementing these. I mean, it is what it is. We're all in this together, and we hope everybody's an informed consumer. I mean, that's why the Smart Shopper program encourages you to call them if you're having a planned service and have them cost comparison and say, this network provider costs this much and this one it costs this much. Totally up to them if they still choose to go to the more costly. But if they choose to go to the more cost effective, we're going to give you some money just because you're saving all of us money.
Mission is healthier employees at lower cost.
Absolutely.
One would feed the other.
Well, and the whole idea is we want the counties to be able to offer a good benefit plan to their employees. If costs continue to rise, we're very aware.
Mhm.
Those are situations that employers have to make choices, and we want to offer a good benefit program, but maybe we have to raise deductibles and co-pays and co-insurance, and we'd like to try to keep that from happening. So that's my spiel for today.
A lot. Coming up.
Hope you all have a good week.
So Al, do you have any questions about this?
Yes, I got a couple. Wendy, on that thing you just demonstrated, you have to do that hookup every time you're doing their exercise, right?
Yeah.
Okay.
Yes, you do.
Other question I had going back to prescription costs, you mentioned that the reason for some of the increase was you have a kind of a backlog of people getting treated for things. How much of the
Well, that's not
increase in-
prescription. That's more
Pardon?
medical. The backlog is more on the medical side, not prescription.
Okay, I kind of forgot what you said about prescription, but the question I had was, how much of the increase in prescription costs was, just general increase?
Well, certainly the trend on prescription it's up about 11% over what it was 2 years ago. So that's certainly a lot of it. What I'd said about prescription is what we're seeing is cost shifting from your previously, maybe 8 or 9 years ago, you were paying for this on the medical side with hospitalizations, and now there is a medication that treats that. And so now you're paying for something that you might have had a hospitalization for $50,000. You're paying for it on the side of there's a medication that's controlling.
Yeah,
Um,
and I know
and
that's because basically
some-
what you're saying is more people are taking medicine instead of other things. And I was just trying to see how, that cost balanced out with actual cost increase for the medicines themselves.
The other thing with medications is there are some medications that are on the horizon that are cures. Those have us real nervous because the actual cost for them is significant, but it's a cure. One of the ones that's coming up on the horizon is, there'll be gene testing to be sure that you fall into the category for it. One of them is for hemophilia. And if you fall into the gene category,
Last time I had.
this medication, which will run between $2 and $3 million per person, but it's a cure. Another one that's coming up is for sickle cell anemia. There are a lot of these in the pipeline that are cures for chronic diseases that are really, really expensive. But you have to, it will only work if it's the gene therapy that you have that actual gene. But that's kind of where we're seeing a lot of the things in medication going. Of course, they're in the news, there's all the stuff about the off diagnosis usage of certain medications it's all over the news on Ozempic and Mounjaro that are wonderful medications for people with type 2 diabetes. But doctors are writing them for people who do not have type 2 diabetes.
Us.
Now, we're not covering them. You're not going to get it through Sebco unless your doctor's lying about your history and providing documentation about your history. In order to get Ozempic or Mounjaro, you have to provide our prescription drug carrier with information that you're a type 2 diabetic and what are the medications you've taken previously and what is the treatment they've done. So I don't believe we have anybody getting that on our, but a lot of people are very willing to pay that $1,700 a month to get that medication.
Something on the news today about causing the diabetes drug, but and they're using it for weight loss, but it's causing cancer and
There are a lot of side effects to those medications. I mean, anytime you see any of the medications advertised on TV,
Half the time
they go through all of these things and you're like,
cure is worse than the disease.
right.
Side effects may concern. Ooh.
The Ozempic, I think the thing that we're really concerned about is it's created a shortage for people who have type 2 diabetes, who really benefit from that medication, because now you have literally thousands and thousands of people taking it for weight loss. That type 2 diabetic can't get it. And we're fortunate right here in this area of Ohio, we're not having this. I know back in the spring up in Northeast Ohio, much more Northeast, they were having shortages, to the fact that people were coming down into your county to get the medication filled because they couldn't get it in Cuyahoga or Lorain or, I don't know. A lot of changes with medications.
Yeah, Wendy, along those lines, I do have a question. Has Sebco or, any of your affiliated healthcare companies done any kind of studies to show whether some of these newer drugs are more effective? Because you see them, and I'll be honest with you, I'm in a situation where I've got a doctor recommending one of these newer drugs, but it's like zillion times more expensive than what I'm taking right now.
To be approved, there have to be efficacy to show that it's effective. The FDA isn't going to approve it if it doesn't show that it's effective. But is it necessarily more effective than a medication that costs half that price? Not, maybe for some people. I'm going to reach way back, and I'm going to use my mom as an example. Back in the early 2000s, before she passed, she had some arthritis. And at that point, her doctor, Celebrex, which has now been out for forever, and it's now one of the less costly medications before you move to Humira and some of the others. But her doctor was recommending Celebrex for her. And my mother's point of view is, she said, I'm just fine with Bufferin. I don't think I need that medication. She said, well, and she was very realistic. She said, I'm almost 90 years old. I expect to have a little pain. I don't expect to be pain-free. I think that sometimes we get sold on an idea of this medication is going to make everything wonderful. The side effects of a lot of the medications scare me a lot. when we look at what the potential long-term side effects of some of these meds are, have those of us in the insurance industry a little nervous because some of the long-term side effects are liver damage, kidney damage, and you're looking like, if somebody's been on that medication for 15 years, are they going to have a functioning liver in 15 years? Are they going to have functioning kidneys in 15 years?
We did quite a bit of international travel when our kids were small, and my son had a fever in Germany. And we thought, well, we'll just get Tylenol. He was fairly small. Tylenol is not available at that time in the whole of Europe for fear of liver damage. It was not approved by the European community.
Aren't they
But
wise?
it's widespread here.
Yeah. And now we've got all kinds of people who've used Tylenol for 20 years with a lot of liver damage.
Yeah.
Yeah. Yeah. So
Those are the only questions I had. Thank you.
thank you.
Okay, thanks, Al. Do you have anything for Wendy?
Nope, I'm good. I just point out that I once saw an ad that said 253 doctors recommended a specific form of cigarettes. So the medicine is actually never, and the science is actually never settled, despite what some may think.
Carl, hot off the press, I have an answer from Verizon. They think go live will be mid to late August. So your ability to stand at the 50-yard line will be close.
Well, I'm going to simply ask that it be done. Otherwise, I'll stand on Jake Furr's shoulders.
Perfect.
Well, I think Lucas plays Clear Fork in the first game, but I'm not sure whether it's in Lucas or Clear Fork.
Hopefully at Clear Fork because the signal is loud and clear down in the valley.
Yeah, the mayor down there is doing a great job, Carl.
Down there.
Well, thank you very much. Have a good week.
Okay.
Thanks, Wendy.
Thanks, Wendy. Thanks for coming. Any other business to come before the Board of Commissioners? Hearing none, the Richland County Board of Commissioners at 10:31.
Careful, Wendy.